Hi, I'm Dr. Gulani. First, want to thank all of you for your inquiries, your responses, and your interest above all, following the live that I did last week on keratoconus. This week, I'm going to dedicate to how we correct radial keratotomy patients and actually can bring them to 2020 in many cases. My team will prepare all the material for you this week and keep posting for you, so please enjoy that. Call me with any questions. So RK, as you know, radial keratotomy was a surgery that started in Russia and got very popular in the 1980s. Many patients had this surgery, thousands of patients, where you take a diamond blade and make radial cuts on the cornea. And these patients were treated for their nearsightedness. Over years, as you know, patients become farsighted, they cannot read, and other issues like irregular astigmatism, which deprives them of their visual quality. What I like to constantly share in over 20 years of having corrected RK patients of practically every kind is, actually these patients can see. There are procedures like laser corneoplastique that without cutting the cornea, you can shape these patients to excellent vision. And
I love how you're always trying to teach and you're doing your thing, but please get some rest for my surgery tomorrow.
Yeah, great seeing you. Yeah, you okay too?
Yes.
We are live, guys. This is like,
Oh, sorry, we're so sorry.
that's coincident.
Yeah.
You're RK.
Yes.
I'm talking to doctors, people about my passion to correct RK cases, and tomorrow we're doing your second eye. But mainly I'm talking about the impact of how RK patients, no doctor should give up on them, they do have potential. That's what I
Oh, absolutely. Can I say something? I'm a police officer, so my vision is extremely important to me. When I started having fluctuations in my vision because of the RK, I looked around and I went to a bunch of different surgeons down in South Florida. Nobody would touch me. And nobody could correct me. Everybody said it was impossible. I started doing some research and I found Dr. Gulani, and we came up here and I had the right eye done about 3 months ago, and now I'm seeing 20/20. So I'm back now to get the left eye done, which will be tomorrow. So hopefully he gets some rest. Puts a Superman cape on. He comes back tomorrow and we go 20/20 with this one.
What do you call this? Photobombing?
Yeah.
What do you
Yes.
I'm sorry. But guys, listen, in all seriousness, you can be helped, you can be corrected. This is the man. So
Thank you so much.
Testament.
I'll rest you
We're
my
leaving.
body.
Okay, I'm sorry.
All right.
He's already so excited.
See you.
Bye.
So, I don't know what to call that, photobombing maybe for now, but yes, I do believe, and the biggest thing I want to convey in this live, Facebook Live is, I want every surgeon to believe that these patients can see through their cuts. That gentleman, coincidentally here for his second eye surgery, has traveled back. He has 20 cuts. Doesn't matter. The other eye I'm doing tomorrow for him has had RK with LASIK, with other surgeries. Doesn't matter. Shape the cornea with a non-cutting technique. Now, RK patients also, because they had surgery in the 1980s, can develop cataracts with age. Cataract surgery is difficult in RK because anatomically you have to enter through the cuts, and mathematically you don't know how accurate you will land with vision. But even those cases can be corrected in many cases to 20/20 without glasses or contacts. So it's very important to understand that RK patients who had radial keratotomy, should not lose hope. Sit down with your eye doctors, your eye surgeons, optometrists, opticians, talk to them, and don't give up on the goal of 20/20 without glasses and contacts. Of course, each case is different, as you'll see as we keep posting my materials and teachings on our website now for you all this entire week. But if there are eye surgeons watching this, please raise the bar. Do not give up the fight to bring each of these patients to 20/20. I call it seeing outside the cage, the lion's cage, meaning the cuts are there, but they still see great despite that. Don't get worried about the cuts. And for other doctors out there with contacts, glasses, optometrists, opticians, please do your work to help these patients through, with or without surgery. So there's a spectrum of different technologies and techniques available. You can have premium cataract lenses like toric lenses in many cases, pseudo-accommodative lenses, and can see distance and near despite your RK with your cataract surgery. So don't give up hope. This is Dr. Gulani once again. I have to leave for surgery. I'm getting the cues, and I'll see you guys next week. Take care.